Welcome to Leyes Cotidianas, or Everyday Law, where we discuss the laws that affect you every day. Today we will be discussing the Affordable Care Act, or Obamacare. It's very controversial. Many people like it, many don't. Today we will be understanding and learning how it will affect you. Please join us on Leyes Cotidianas. Welcome to Leyes Cotidianas, or Everyday Law, where we discuss the laws that affect you every day. Today we will be discussing the Affordable Care Act, or Obamacare. Obamacare has been very controversial. We're here to understand and hopefully learn how it's actually going to impact us. Helping us with that is Donna Bergeson. Donna Bergeson is an attorney who specializes in healthcare law. She has been named as a leading attorney in healthcare throughout the country. She is a partner at Alston & Bird, one of the largest law firms here in the Atlanta area. Thank you so much for joining us.
Thanks for having me.
All right, so it's been very controversial. Many people have said this is what it's going to do, this is the horrible impact it's going to have, or this is the wonderful impact it's going to have. Hopefully you can help us understand what the impact is simply going to be. Can you tell us what it was meant to do, and then also what impact it's going to have, and then how it's actually going to be phased in?
Sure.
Okay.
It's probably helpful to start with what it is intended to do.
Okay.
The Obama administration, their original goal was to cover all Americans. Mm-hmm. It was recognized early that that might be too ambitious. So the goal at this point is to cover more Americans than are currently covered with health insurance.
Okay.
To have as many Americans covered by health insurance as possible. The law does that with some incentives and with some punishments, with some carrots and with some sticks.
Okay.
But recognizing that healthcare coverage, a lot of people who have health needs, if they got preventative care early, it would cut a lot of the expense out of health care at a later time. So there are a number of goals to incent employers to offer health insurance.
Okay.
And there is a mandate which requires individual Americans to purchase health insurance.
Okay. Let's talk a little bit about that mandate. How does that work? What would they be required to do, and when?
All Americans, as of January 1, 2014,
mm-hmm.
are required to purchase health insurance.
Okay.
It is, they will have some incentives for Americans who are below the poverty level, mm-hmm. to help them pay for that health insurance. And if they are 4 times below the poverty level, then their coverage will be fully subsidized.
Okay.
But subsidies can run to where no one will pay more than 9.5% of their income.
Okay.
To pay for health insurance.
Okay.
But it is going to be required, much like registering to your children for college or for mm-hmm. elementary school is required. Mm-hmm. At this point, all Americans will be required to purchase health insurance.
Okay, so it's not going to be an elective issue or a choice with regard to whether you can afford it. You're going to have to make some effort to go ahead and get it. How is it that they would be able to do that? We've heard a little about exchanges and so forth. How is it that that they're actually going to be able to purchase this, and what are some of the things that are going to allow them to be able to do that? Because healthcare can be very expensive, or health insurance can be very expensive.
Very expensive, and the reason that the Obamacare administration is putting in a number of safeguards is because the costs of healthcare just continue to rise. Mm-hmm. But we're going to start with employers.
Okay.
There is not a requirement mm-hmm. For employers to provide health care coverage.
Okay, so many people have said that there was a requirement.
There's an effective requirement.
Okay.
Because if a health care if any employer does not purchase it, they'll pay fines.
Okay.
Which is why the Supreme Court said that the law was constitutional, because it wasn't that an employer is being forced to do something. They could pay a fine if they don't want to do it. Yeah, it's a little close, because really they are required to do it.
Okay.
Any employer who has at least 50 employees is required to offer health insurance, affordable health insurance, to their employees. If they don't do that, they will be fined. Employers will be fined.
Okay.
It is required to be offered. An employee does not have to purchase it from the employer. If the employee would like, the employee can purchase it on an exchange.
Okay.
There will be federal exchanges and state exchanges. I would say think of the exchange as being a farmer's market.
Okay.
You can go, the employers, well, there'll be two exchanges. There's going to be an exchange for small employers.
Okay. So the under 50?
The under 50.
Okay.
And they've called that SHOP.
Okay.
So what they're trying to do is encourage healthcare insurers to basically go to the farmer's market and set up a booth offering what type of insurance they have. Under the law, there are benefits that are required to be provided, and they're going to try and make it so it's much more visible as to what you're purchasing for health insurance.
Okay.
So there'll be a standard checklist, if you will, of this policy covers these things, this policy covers other things.
Additional things.
Additional
so
things
there's sort
or
of
less things.
A core things that everybody has to have.
Correct.
And so there's sort of the lower end, and then you can have add-ons in essence.
Exactly.
Okay.
And then the checklist will be standardized so that as an employer, as a consumer, orients him or herself to what's available, the format will look the same. You know, when you go to a car dealer and you try and buy a car, and there's a format. You always see the MSRP in a certain area, and you see the extras in a certain area, and so people can adjust their eye to what's really being offered. The law requires the insurers on the exchange to do that as well.
Okay, so you sort of feel like you're having apples to apples as opposed to apples and oranges. You're not really sure how do these two things mesh. So now they're trying to keep it even.
Absolutely.
From that standpoint.
Or at least keep it standardized.
Right.
So folks can get a grip as to how they differ, what benefits are included. There are a core set of coverage of benefits that must be offered on every plan. They're called essential health benefits, and essential health benefits are going to be required by every policy. It's interesting because the name of the act is the Affordable Care Act. So not only are employers encouraged to offer health benefits or pay a fine, they're encouraged to be affordable. So if an employer offers a plan that is not affordable, it's too expensive,
right,
and their employees go to the federal or state exchange to purchase insurance, then that employer can also be fined.
Okay.
So, but the power, it is empowering in the sense that individuals can choose. They can choose a plan offered by their employer, or they can go to an exchange and purchase a policy that they feel better fits their needs.
And their families and so forth.
Correct.
And would the plans would be for entire families, I assume, as opposed to just for the individual employee. Is that correct? They would still have those options as well?
Sure.
Okay.
They'll be, a lot of it will be similar. You could purchase a plan for yourself, or you could purchase your family plan.
Okay.
But your family members are all going to have insurance. So if you do not purchase for your family, the family's going to have to go on the exchange.
And do it in another form, right?
That's right, because insurance is required. And the concept behind requiring everyone is that right now what happens is the 20-somethings that are young and indestructible and don't feel they're ever going to need health care don't purchase insurance. People north of 50 realize they are destructible and immortal, and they want health insurance. But the over 50 crowd uses health services more than the under 20 does, or the under 30. And so that makes it more expensive. The concept is if everybody buys health insurance, then you can pool the heavy utilizers with the low utilizers, and normalize the cost for everyone.
Because right now, the younger person would come in, and because there's a dearth of those folks, they're actually covering a lot of the higher costs.
Exactly
Is that what's
right.
happening? Okay.
Exactly
So
right.
they're trying to even up the numbers. And of course, the demographics are changing as well, so that's going to play in also, I would think, with an older
Absolutely. The
community.
baby boomers all growing
Right.
up, and studies are fairly consistent to show that most people use more health services in the last 10% of their life
Right.
than they did in the 90% before
Prior
their
to
death.
that.
Yeah.
Right. Okay. All right. There's a lot of discussion about this concept of a Cadillac tax. What is a Cadillac tax? I've heard that term.
Yeah. The health law mandates 10 essential benefits be covered, and so those are required. But the law does not encourage really rich benefits to be provided.
Okay.
And so if you have an employer that offers a health plan that is very generous, that is considered a Cadillac.
Okay.
And the employer will pay an extra tax for offering too rich benefits.
Okay.
In addition, the employee who receives those benefits will have extra amounts added to their W-2, so they will pay more taxes.
Okay.
And that seems a little unfair.
It does?
A lot of people think, well, we did that the Congress did this to prevent better benefits to the C-suite, your chief executive officers or your executive suites, and to not give such good benefits to your line item worker. But in actuality, some of the people that are objecting the most to the Cadillac tax are the industrial workers covered by unions, because a lot of the unions have negotiated really good benefit packages for their members. The concept behind the Cadillac tax is that the government wants individuals to share some of the cost, some of the pain of utilizing services.
Got it.
Because there's a perception that if you get too much free, you don't appreciate it and you overutilize it.
I see. I see.
So it is intended to be a method to keep utilization down.
All right. Well, we've got to take a break right now, but in a few minutes we'll come back and ask some additional questions about the Affordable Care Act. Thank you very
great.
much.
Con inmensa alegría recordamos la época de nuestro embarazo, el nacimiento de nuestros hijos, nuestra preocupación para que se alimentaran, estudiaran y crecieran física y emocionalmente saludables. Permítanos guiarle a través de un embarazo seguro y feliz. Aprenda sobre salud, nutrición e información educativa. Padres e Hijos Atlanta, la única revista para padres en Atlanta. Una publicación gratuita del mundo hispánico.
Welcome back to Leia's Cotidianas. Today we're discussing the Affordable Care Act, and with us is Donna Bergeson, a partner at Alston & Bird, who is a leading healthcare attorney. And you have been giving us some wonderful background on how the Obamacare legislation is going to be impacting us. Before the break, we were talking a little bit about a Cadillac tax and sort of keeping with the car concept. Let me ask you, a lot of folks seem to be frustrated or express some concerns about this idea of that there's an individual mandate. Tell us, if you can, a little bit about sort of the reasons why that's an issue, or maybe shouldn't be an issue, or why people maybe shouldn't be as concerned about that as they seem to be.
Yeah. You know, it's interesting because a common theme you hear people say is, you shouldn't tell me I have to buy something. So the controversial aspect is the government is telling people they have to buy health insurance, and doesn't really comport well with the American thought process of, you know, freedom of choice, and I can spend my money however I want to. Detractors would often say, yeah, but people have been required to buy health insurance for years. And that's true. The distinction I think you hear most people make on that is driving is a privilege. So if you want to exercise that privilege, our government, for the safety of other Americans, requires you to have insurance.
Okay, so car insurance, different.
Car insurance is very, very different. Health insurance, breathing is is not an option. I mean, it's not a privilege. And so while I could decide I don't want to buy health insurance and decide not to drive, that's fine.
You mean buy car insurance and decide not to drive, right?
Right. I can't do that with health insurance.
Right.
And the government is forcing people to purchase health insurance. The analysis, though, has been that the Supreme Court said, well, we're not really forcing you to buy health insurance, because if you don't want to buy health insurance, you can pay a fine.
Right.
So that's how they get out of the constitutional prohibition about how can you tell me how I can spend my money.
Right, okay. So they're not telling you how to spend your money, but they will fine you if you don't spend it a certain way.
Correct.
So it's a little end
which
around.
is what our tax system does. It encourages certain behavior, and if you don't do the behavior they want, they charge you more money. If you follow the lines, then they don't tax you as much.
But you're free to make that choice.
But you are free to make that choice, and if you do not purchase health insurance pursuant to the individual mandate, on your tax return, you will have to pay a fine. I don't know how that's shaken out yet, exactly where that fine will be. I'm assuming there'll be a check the box. Do you have this? If you do, check the box and go immediately to the next line. If not, enter you owe $2,000 more on this line.
I see. Okay. So that's how they will end up trying to enforce it at the end of the day.
Absolutely right.
With that tax. All right. If there were sort of a top 5 list of things that folks would need to know about the Affordable Care Act, what would those be? And could you just kind of explain what those might be?
Yeah, I think there are 5 aspects of the Affordable Care Act that every American will be happy about.
Okay.
From a personal basis.
Okay.
The first is insurance companies can no longer reject coverage because of a pre-existing condition. That comes into effect in January of 2014.
Okay.
There were limits placed on that. Affordable Care Act passed in 2010. It is being implemented in stages.
Okay.
More excitement about it now because most of them come into effect in 2014. So a good thing for everybody is no longer can you be excluded. If you've had cancer, under the current system, a lot of people who've had cancer or some chronic diseases, when they try to get insurance, they get rejected.
Even if they could afford it?
Even well, yeah, they won't even. It's not offered.
That's what I mean.
That's right.
Okay,
even it's just not offered. You're too high of a risk.
Got it.
So that's a really good thing for all Americans. Another good thing for all Americans is that there are no longer going to be permitted any annual limits or lifetime limits.
What do you mean by that?
Most insurance policies, and most Americans don't know this because they've never had to invoke it,
Okay.
but most of your insurance policies do have a limit. They say we won't pay more than, say, $1 million worth of benefits in any one year. And there's usually also a lifetime limit. We'll never pay more than, say, $3 million of benefits on your behalf, even if you pay all your premiums. Once you hit those limits, the insurance company stops paying. Very problematic for people with expensive diseases like ALS or cancer. Cancer survivors who fall back and get the
Remission,
cancer
right.
reoccurs. Oftentimes they'll hit up on those caps. They had insurance, it might have been good insurance, but once they hit the limit, the insurance company says, all done. Much like in your car insurance, if you have $100,000 coverage, if more injury than that, the insurance company only pays up to the $100,000. People don't realize that that's in their health insurance because most people don't hit up on it.
Right.
Those that do, it's really hard, devastating.
Right.
So those lifetime and annual limits are no longer going to be permitted.
What about preventative care and things that will, you said at the beginning there was some part of the policy is to do some things sort of at the front end so that people wouldn't have the higher costs on the back end. Is that one of the sort of the top 5 things you would think? Or
yes, I would. The Affordable Care Act also instituted what they call essential benefits.
Okay.
There are some benefits that all plans have to cover, which we talked about. One of them is some preventative care, such as immunizations for children has to be provided, and you can't require the insured to participate in the cost. That's got to be without any cost sharing. A lot of women's health, mammograms, pap smears. A lot of those are not so controversial. There are some essential benefits, preventative care, that are have been controversial. One of which is they have determined that an essential benefit is birth control. So birth control and sterilization has to be offered with no cost sharing to the employee.
Okay.
A lot of employers and a lot of religious organizations have objected to that being an essential benefit.
Something they have to provide that may be against their mandates and policies and beliefs and so forth.
Right.
Okay.
They don't want to provide that. But under the law, all insurance coverages have to include that as a preventative service that the employee or the dependent can get without cost sharing.
Got it. Okay.
Another really good coverage for most Americans is that their children under 26 can stay on the parents' plan.
Okay.
You know, I have children. I'm very grateful that they are employed and not covered under my plan right now. But there are this is a bad job market. There are a lot of 20-somethings out there that can't get coverage.
Right.
And they're entitled to be covered under the parents' plan even if they're married, even if they are not a dependent.
Wow.
Technically
Okay.
a dependent for tax purposes. They can still stay on your policy.
Up through 26.
Up through age 26.
Okay.
So I think that's something most Americans are happy about,
Okay.
Especially in this economic time.
Now, with the addition of the folks that are the young adults, is that an additional cost associated with their coverage? I assume that they would be one more person on the plan, so there's some
Absolutely.
additional cost. Okay.
Absolutely.
Okay.
And that is something that insurers can take into account when they set the premium. But another really controversial part of the law is there is a cap basically on the profit that an insurance company can make. Under the law, people have probably heard about the 80-20 rule. So 80% of all premiums have to be used to provide health benefits for their insureds, which then the other 20% is for administration, and for-profit insurance companies, it's profit. So
Okay.
that it's going to become more of a regulated industry, like your utilities,
Okay.
which will be interesting to see if you see a number of insurance companies just say, you know what, I'm going to make my money elsewhere, because there will be a limit in the free enterprise economy to how much money an insurance company can make.
Right, and how much they can charge and who they can cover. They're going to have to cover everyone. They're going to have to provide basic benefits for everyone. So there's going to be a very different, to get an entree in there, they're going to have a very different model than they used to have.
Healthcare is already very heavily regulated. Somebody told me once there are more regulations covering the healthcare industry than there are the nuclear industry. And PPACA, or the Patient Protection Affordable Care Act, only just exponentially increased it.
Okay.
Which is, I think, a real fair criticism. Is the act is 2,000 pages. I am a lawyer. I'm a healthcare lawyer. I read this stuff for a living. It is tough to get through.
Okay.
So for most Americans, shows like yours is going to be important so people know what's in it.
Okay. Well, let's talk about, are there any particular ethnic groups or communities that would be particularly impacted by this law and how it's going to be implemented? Say, for example, the Hispanic community. Is there anything in this law that's going to affect them positively or negatively that you see?
I would say both.
Okay.
The government would spin it's all positive, and there are lots of positives. Most of the positive is not particular to the law, but particular to the Hispanic population. More than a third of Hispanics are uninsured right now. So hopefully this will increase the level of insurance for the Hispanic population. The problem is it's very complex. The law is very complex, and people are going to have to register. And there are community health centers right now that are existent that will help Hispanics or other groups figure out how to get signed up. Studies have shown that about a third of people who utilize community health centers are Hispanics.
Okay.
So in that sense, the community health centers are gearing up to help Hispanics register.
Okay.
But there will still be complicated forms. They're doing their best to try to make them not so complicated, but it is complicated to the extent that there are reading difficulties, literacy difficulties, or language difficulties, that's going to be exacerbated
I see.
for a minority population that if their primary language is not English.
Right.
I do believe that they're trying to put resources toward that. Whether that will be enough, it will be interesting to see. Another interesting aspect for the Hispanic population is there are certain diseases that are more prevalent in Hispanics. Breast cancer, for some reason, is more prevalent in an Hispanic woman than it is in a Caucasian woman. So in that sense, the expanded coverage for preventative care,
The mammograms and so forth will be helpful.
will be very useful.
Okay.
Diabetes is also much more prevalent among both genders in the Hispanic population. So there are some things, and I think the government's touting this as being very pro-minority. The comment will be important, though, is a lot of people who might otherwise be eligible might be afraid to take advantage because perhaps their household has a mixed integration status. Maybe their children are American citizens and entitled, but their parents may be undocumented. They might be afraid to register their children. So it's going to take a lot of community outreach.
All right. Well, thank you very much. I think you have really nutted down this 2,000-page bill into some small bites that we can hopefully understand, and hopefully as it becomes a law and is implemented, it's already a law, as it becomes implemented, folks will take advantage of this and hopefully benefit from it. But thank you so much for joining us. Thank you for joining us on Leyes Cotidianas. Please join us next time when we discuss more laws that affect you every day. Be sure to like us on Facebook, visit us on YouTube, and visit our website, leyescotidianas.com. Thank you.
Leyes Cotidianas les llega a ustedes gracias al generoso apoyo financiero de la Fundación de Justicia Civil del Estado de Georgia. Mundo Hispánico, el vocero de la comunidad hispana desde 1979. La estación transmisora WPBA no tiene licencia para practicar leyes en el estado de Georgia. WPBA y los patrocinadores de este programa no son responsables por las opiniones expresadas ni la información proporcionada por los abogados en este programa. Este programa se ofrece como un servicio público. El objetivo de este programa es de informar y educar y no de proveer consejo legal. Si usted necesita consejo legal, favor de consultar a un abogado.